Hello, hi. Today I'd like to talk about weight gain with psychiatric medication. I think we try to do this little series of things which might be of interest to patients or relatives. So today we're talking about weight gain. The problem is that many medications have side effects, and weight gain is a very common side effect of psychiatric medication, especially antipsychotics and antidepressants. So, and this non-compliance means patients don't take their medication, and they don't take the medication simply because they feel that their weight is increasing. And sometimes this is not that much, but everybody has a different attitude to what they feel is a weight gain. Sometimes the weight gain is quite substantial, and some medication even lead to subclinical or even clinical diabetes. So for this reason, weight gain affects self-esteem. It can be embarrassing if people have too much weight, and so it has to be addressed. The point is, these most common medications are antipsychotics. There are different types of mechanisms, and I can't go into details. Some say that the weight gain is the consequence of increased sedation. People sit more and eat the same, then they get more weight. Or some medications have specific anticholinergic effects. Acetylcholine is a neurotransmitter, and if this is reduced by the medication or blocked by the medication, then people are more thirsty. And if they drink sugar-based pop or any other drinks, then they can put on weight. Sometimes, it's assumed that the metabolism is reduced or that fluid is retained by specific types of medication. Some people have discussed that different neurotransmitters are affected. Serotonin blockade, histamine might be affected, and H2, specifically H2 receptors. Others say that genetic risk factors have been had an impact. However, this is very much for the specialist to see what happens. What I want to say is it's an important issue. In some groups, so females have a higher risk of weight gain under medication. If people have a history of overeating or bulimia, or if they have a family history or personal history of obesity. There are specific medications. I will come to that in a minute. But or maybe I just say it now, we have looking at antipsychotics, we have clozapine, olanzapine, chlorpromazine, which usually have the highest risk. Quetiapine very often also has a high risk of weight gain. The important part is that it seems that these medications people eat more, and less effect on weight is risperidone or fluphenazine or paliperidone. Haloperidol, amisulpride have a middle risk, and aripiprazole usually has this a lowest risk. However, it's very important that everybody is different. So people who might have a big might be overweight doesn't need to get more weight on let's say olanzapine. It does affect 40% of the people who have an increased risk. It can increase easily a stone. However, in 60% of the patient, more or less nothing happens. So the question is, everybody responds slightly different. Can't even antipsychotics. There's some antidepressants have more or less the same effects. Some reduce the metabolism. Craving for carbohydrates, which means sugars, and but that's difficult because some of the depression itself can increase the weight by people having more appetite and craving for sugars. Serotonin has been histaminergic receptors as well. So specific agents or specific medications which cause weight gain are mirtazapine, olanzapine, tricyclic medication, especially the more sedating medication. Some say monoamino oxidase inhibitors, citalopram and paroxetine, but that's not very common, or at least it's not as bad as other medications. Right. So then we have some medications where it's more or less likely that people lose weight, which is fluoxetine and bupropion. Fluoxetine is one of the classic anti-SSRIs, so that might be something one people can think about. So the other thing is what can be done. So usually not much. The doctor can give you some advice about how to eat properly, and they can tell you that you should do some exercise. Some doctors would say, okay, let's involve or let's get the advice of a dietitian, and so this should be offered, especially if the weight gain is very substantial. The other option which a psychiatrist might try is taking the lowest possible therapeutic dose. However, this is always difficult. It's a balance. My view is usually increase the medication if you can to a very therapeutic dosage. If it doesn't work, and because you suffer or side effects you can't cope with, you have to go for another medication. But that's usually a bit of a balance. Some people say much better with this medication, which is sedating, let's say olanzapine. I'm fine with that, but I struggle with the weight gain. So then it's a balance whether you take the risk to go for another medication. The problem is if someone is fine on one antipsychotic, it doesn't mean that they're fine on the other antipsychotic. So it's a bit hit and miss, and one has to see individually what can be done. Okay, so switching to another medication, antidepressant or antipsychotic, one can try to give some extra medication, naltrexone, but usually that's not really very helpful. Usually it's more or less, whatever, trial and error, nothing else helps. Usually decent advice, physical activity, and trying not to eat high carbs, that's the best. People very often forget that drinks can have lots of calories, including alcohol. Right, lithium, that's another medication which is a mood stabilizer, can increase the thirst. People have an awful lot of thirst, sometimes drink up to 4, 5, 6 liters a day. That shouldn't happen. If that happens, the GP should be involved. Some people say that the insulin is increased, and there might be some risk of edema. So the question is, what should be done? Make sure that you don't drink high-calorie drinks, and if possible, exercise and have the decent diet. Mood stabilizers are very often given in psychiatry. Carbamazepine might increase the appetite. Valproate, there might be changes in leptin and insulin, so that might cause some weight gain. Some patients have gabapentin increased weight gain, and usually a good option for people who are at risk for weight gain is lamotrigine. So, but sometimes, even if if you change to some medication which has some risk, it doesn't mean that the risk has to be realized. So this is a bit of an overview about weight gain. It's not comprehensive. If you want to find something scientific, you can go to PubMed and put weight gain and psychiatric medication into the search engine. This is just to give an overview for people who are